Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Paul Julius, the CEO and co-founder at Thread Health. Paul, how are you today?
I'm great, Jared. Nice to talk to you.
I'm excited. It's great to learn more about your company. I'm very fortunate that I get to talk with companies at all parts of their life cycles, and I'm glad you're building something special. I'm glad we were able to catch you not at the very beginning, but early in your journey as well. I know we'll be able to kind of talk through the company for many years to come. So let's dive right into it, if you don't mind. Let's if you could start by telling me a little bit about your background, that'd be amazing.
Again, I'm Paul Julius. I'm the co-founder and CEO of Thread Health. I've been a startup operator for about 9 years, physical therapy, then at Heartbeat Health, which is one of the largest digital cardiology clinics, and now leading Thread Health, which is focused on adolescent care.
And one of the things we often have guests talk us through is the why, how, what of the company. If you don't mind, kind of diving into that, I know our audience would love to hear that.
Yeah, so I am a dad of two. My mom is a 40-year retired teacher. I am extremely nostalgic about my teens. And I have this kind of unique perspective of health, having been in physical therapy and cardiology, where a lot of that is applied healthcare education. So when thinking about what to do next in health after Heartbeat, Thread Health and adolescent care was one of the first things that I thought about. And it's one of the biggest areas where we're lacking in health. So when I think about my kids and being nostalgic, there's nothing better to do. Teens make and adolescents really make up 20% of the population. It's a huge area. It really extends from ages 10 to 25. So it's a really big area where, applied health education, primary care that involves the teen, the parent, and doctors, and kind of you know, broken down into pieces. And when things are front of mind, can make a really big difference.
And you mentioned it a little bit when you were kind of giving us the why, how, what, but this is not to knock teens. We were all teens at one point, right? Why do teens need virtual care? We often hear about the older population needing virtual care. We often hear about the youngest population needing virtual care, but why do teens need it?
Well, a couple of things. In terms of the structure of healthcare now, teens go in for an average 2 visits per year. Um, and I think I mentioned before, this is where we make our first healthcare decisions. So 2 visits per year is not enough time to speak to a doctor and learn about health. And Thread Health, the name really implies kind of tying everything together. So that's where the name comes from. So structurally, it needs to change. Um, Teens, they care about their health quite a bit. Um, they're not given a way to do that. There's a kind of a guardian child relationship that's kind of hard to overcome. And we can do that through digital health tools to make it easier for them to communicate, and in a way that's in their own terms and when things are front of mind. So, what we want to do is make it as easy as possible for teens to speak to doctors and help really with that guidance. So, maybe a teen isn't interested about learning about their health when they're 10, they're 13, they're 15. But if we use digital health, then we can have them involved in their healthcare, interested to learn about it, and do that in the right way with which things that are really relevant to teens. They have sleep issues. 70% of teens have had sleep issues. 80% of teens have acne. 50% have problems with acne. They're, of course, just like, pediatrics, 2 to 5 colds per year, and then just things that really weigh on them. So we can help out with all those questions by connecting them with a doctor and having that in the right way. Um, we do that through SMS and text-based care. So that way they can reach out the way that they prefer. They spend, in some cases, 6 to 8 hours a day on their phone. Text have a 98% open rate. So if there's a best way to talk to teens, it's through text and through SMS.
Interesting approach. Makes sense. It's a rare occasion where you see a teen not texting. So I think you're spot on. Can we talk through a little bit about how, like, and again, I don't want you having to dive into certain, like, if you don't want to say something because it's part of your strategy or anything, but like, I do want to dive into, if you don't mind, um, capturing the attention of teens. What does that look like?
So my co-founder is Dr. Hina Talib. She is an adolescent care specialist, and she completed adolescent care fellowship at Montefiore. In fact, she ran and was directed the Montefiore Adolescent Medicine Fellowship, and that's how we built our team. Hina kind of complements what I've done and operated as an operator, but not only as a someone who can speak to teens, to parents, but also has is a really strong creative talent. During the pandemic, she started a Instagram channel called @TeenHealthDoc and grew that to 80,000, 90,000 followers. So when kind of engaging this population, you want to be quick, and we see that in a lot of the conversations that we have to teens, getting to the root of the problem quickly, treating them with respect, and that's how you get their attention, is through that, and you do that over time.
Love that. A great approach. It'll be interesting to see how you continue to build out the business. I'm excited for you and the team. My last question for you today, Paul, is what's next? What are you getting excited about? You personally within the company, you as a team. Would love to hear that.
So our team, it's 8 doctors, 6 are adolescent care uh, specialists, and there's only a small number of those across the country. So Thread Health is a really great way to access specialty care. And we've been around for a little while, and we just launched in New York. So we're starting to see patients, and really seeing kind of the results of those conversations happen. So, maybe a teen or a parent starts off a conversation, maybe it moves to a group conversation with the teen and the parent involved, and then also confidential conversations with teens as well about issues that they're having. And what's really exciting about what you do when you kind of move teen health to a digital setting is that teens start to reach out on their own because they have their ability to do that. So what's really exciting about focusing on teen care is that maybe a teen participated in 10-20% of the first conversation, but by the time you kind of gain their trust, you've developed a relationship with the company, then they'll participate in 50% of that conversation. So you really have that magical experience where they come to a trusted resource to talk to about their health, and that's something that all parents are really excited for, and that's what we just want to continue to build.
Well, Paul, I'm really excited for you and the team. I definitely want to have you come back on again real soon, and we can dive into some different topics here. This is kind of your quick overview to the Slice of Healthcare Network, but really appreciate having you on. Anything you want to say before we wrap up here?
Thanks, Jared. Thanks for having me. Our website is threadhealth.com. And if you want to reach us, you can reach us at paul@threadhealth.com or hina@threadhealth.com as well.
Thanks, Paul.